Hi, so today we are going to do an MS assessment, and Matthew is going to be the patient. So with an MS assessment, we usually start with a question answer part, mostly regarding past medical history. So Matthew, do you have diabetes or any autoimmune disease like lupus or hypothyroid?
No.
Does anyone in your family have a disease like that?
No.
Have you experienced any changes such as numbness or tingling in any of your extremities?
No.
Have you been tripping a lot or anything new?
No.
Any trouble walking?
No. No trouble.
Are you a smoker?
No, I'm not a smoker.
Do you exercise?
Not regularly.
Okay, when you exercise, what do you do?
I walk. Okay. Long walks. I take, maybe 3-4 mile walks.
What do you do what is your profession? What do you do for a living?
I'm a nurse. I take care of people. Okay,
is that a pretty physical demanding job then?
Oh, absolutely.
Do you walk a lot in your unit?
Miles.
Okay, and you do that 3 times a week?
Yes.
Okay. So that's basically a lot of the beginning part. If he was experiencing symptoms, we go into more details of what the symptoms are and how long the onset has been. Okay, so the next thing with this physical assessment would be to make sure the patient watching the patient walk. So I'm going to have Matthew walk. Go ahead and walk for me. And when he's walking, we're going to look to make sure that he has his strides normal, that he's not tripping, that his gait looks good. He's having no issues with that. And he looks pretty good doing that. It also shows that he's strong too, that he's able to support himself without problem. To continue our physical assessment, we're going to do a neurological exam. And we're going to pretty much start with top down. So I'm going to first start by checking his pupil constriction with a light. So I'm going to shine a bright light in your eyes. And both eyes do constrict equally. I'm going to have you follow this, just moving with your eyes, not with your head. And good. And what I was testing there was for the full extraocular movements and motor, which he is fine. I'm going to have you smile. Great. I'm also going to check how your jaw is. Open up your mouth and close. Good. Any pain when you do that?
No.
Okay. So we're checking joint pain too, because a lot of times the patients will have problems with their joints. So we're going to check your range of motion with your arms. We're going to go up and around with both arms. Any problem?
No.
Okay, good. Next thing, you take your hands and clasp them behind your back and kind of put them as high as you can. Any problem with that?
No.
Any pain when you do that?
No pain.
Okay, good. We kind of assessed his leg strength by watching him walk, but if he was laying in a bed, you could test it by having him push against your hands with his feet. To test his arm strength, you're going to have to put his arm straight up like this and pull me towards you. Great. Now put your hands out, push me away. And he's doing that with force and he's strong. I can also have him squeeze both my hands. Go ahead, squeeze as hard as you can just to check for bilateral strength, which is good. Good. Any problems moving your neck?
No.
Good. No. Okay.
No problems.
Okay, great. Any back pain?
No back pain.
Okay. So I'm going to check some reflexes. I'm going to start with his elbows. So I want him to be relaxed. I'm going to help hold his arm. I'm just going to go to the tendon. Some people use a hammer. You can actually use your hand too and test with your hand. Just going to go in hard. I find it a little easier to use the hammer. You're just looking for a little reflex. Oh. Okay, good. And then you can bring it down and also check this reflex. Okay. And we'll check the other arm. So we're having him relax. I'm just feeling for the tendon. Good. So I have a little reflex there. And the radio. Good. So next we're going to check his legs. Kind of sit back a little bit for me. We're going to check his knees, the reflex. We want him to be really relaxed. So sometimes the easiest way to do this is have them cross their legs. So go ahead and cross your leg for me. So it's kind of have him relax it. If someone couldn't do that, you could hold their leg for them. So you're looking for the tendon. And he just has one. Good. He's having a little reflex. Cross the other way. genes I'm making this hard. I'm so wrong. Okay, he does have a reflex, I'm just not hitting it. Okay, so another thing too is we're going to check to make sure that he can. Okay, so we're going to continue to with the assessment, and we're going to check for Babinski sign. How we do that either is with a hard object, and we'll use their pen light, the bottom of the, like, use on this, or some hammers have like the bottom part, something hard enough to drag it up the foot. What we're going to do is we're going to drag it up. I don't know what his foot did, but that we want to drag it up, and we want the toes to curve in. Curve in, because when they go out and they fan out, that's a sign that something's wrong. So normally they should fan it in, not fan out, which is dead. To go back real quickly, I wanted to also assess some more motor assessment in his face. I want you to close your eyes, okay, and don't let me open them. Good, he doesn't let me open them. If there was a problem where he didn't have strong muscles, I could open his eyelids against him. Stick your tongue out, go side to side. Okay, shoulder shrug for me. Good. Put your arms up like this. Okay, and don't let me push you down. Good, nice and strong bilaterally. That's some signs that you would also look for. Next, we're going to test sensations. So some people take a pin and they'll do sensations. Some people use different little things. I have this little brush on my hammer that works for it, so I'm just going to use this little brush, and I'm just going to see if he can equally feel things. So, turn it up. Can you feel that?
Yeah.
Okay, and I'm going to test it bilaterally. Are you able to feel that?
Yeah.
Good. How about up here?
Yeah.
Here?
Yes.
Good. So you can also test on his legs, things like that too. And then also you can always do just a regular test where you do all vital signs with temperature, heart rate, pulse ox, and of course blood pressure. So we're just going to do a quick blood pressure on Matthew, and then we are done. The next step would be if he had positive signs, the doctor of course would confirm, and then probably order things like an MRI. So real quickly, we're going to get his blood pressure. And you're 130 over 70, so a little bit hypertensive. But anyway, thank you. So, and that is how we would do a MS assessment on a new patient who's not been diagnosed with MS.